Fancy a quarantini? Not so fast. Drinking during the pandemic to escape stress and boredom may be harmless for some, but for others, it's a slippery slope to addiction. Public health bodies are warning that substance abuse is on the rise. Many who suffered from addiction before the coronavirus outbreak saw their therapy disrupted or cut off altogether. Some are calling it a pandemic within a pandemic. Addiction is a global problem. The pandemic has led to a rise in fatal drug overdoses in Canada. Some users blame the temptation of the government's sudden public cash infusion with few questions asked. Demand for help has soared in the US as addiction treatment budgets are slashed. And the UK is reporting long waiting lists for reopened addiction centres. Social distancing has slashed capacity. South Africa has reimposed a ban on alcohol sales and announced the return of a national curfew to tackle a spike in coronavirus cases and addiction.
We've now decided that the sale, the dispensing, and the distribution of alcohol will be suspended with immediate effect. There is now clear evidence that the resumption of alcohol sales has resulted in substantial pressure being put on hospitals, including trauma and ICU units.
South Africa already banned the sales of alcohol in the early stages of the lockdown, but the industry pushed for reopening, warning of massive job losses. What happened afterwards? The hospital admissions went up significantly. About 17,000 alcohol-related trauma admissions in hospitals were recorded every week. That's why for now, the liquor stores throughout the country remain closed again.
It makes no sense to me. I'm going to be straightforward. I'm not going to be rude. I think it's terrible. I think it's unrealistically because in the liquor industry, it's not only people working in the bottle stores. There's about 1 million people now that have to be at home now.
Alcohol is the most dangerous thing. That is why people are always fighting. People who are killed, ladies who are raped, women who are violated every time just because of alcohol. So I support the president. The president was very good. He's done perfect.
The president also announced a night curfew and stricter controls to enforce the wearing of face masks. But many here fear that this might not be enough to weather the storm of coronavirus. There's still a massive lack of intensive care units, testing kits, and a shortage of about 12,000 healthcare workers.
Dr. Monica Barrett from the Royal Melbourne Institute of Technology in Australia joins us now. How difficult has this crisis been for people with addictions?
I think this crisis has been difficult for so many people. Some people have had access difficulties with their treatments, but then there have been some opportunities. For example, people who are accessing methadone and buprenorphine, some have been able to get that in larger doses because we're trying to avoid people having lots of contact with pharmacies, for example.
Is this increase in drug and alcohol consumption addicts becoming even more addicted or more people becoming addicted?
Well, what we're seeing is increases and decreases. So in our global drug survey, in our interim findings, we've seen substances like alcohol and cannabis. People are mainly increasing in the use of those substances, where the opposite trends are true for MDMA and cocaine, where the majority of people say they're decreasing in their use. So a lot of this relates to the different reasons why people use these drugs.
Who's especially at risk, would you say?
When we had a look at our data, we saw that people who were reporting serious mental health problems were much more likely to say that they had increased their use of alcohol or drugs. And so obviously for those people that are having trouble coping with the unusual situation we find ourselves in, they can be especially at risk.
So this is not just a problem for addicts, it's also a mental health problem. Is that what you're saying?
Yeah, it's certainly from our data looks much more across the population. So it reaches a small proportion of people that actually have problems. But what you find, of course, is that alcohol, cannabis and other drugs are used by a large number of people that don't find themselves in an addictive state that aren't seeking treatment, but they too are increasing their use, and that sort of thing can sneak up on people. So we have to really watch out for, I guess, population level changes in drug and alcohol use.
So what's the best treatment when addiction centres are already full due to social distancing, or treatment budgets are being slashed in the US, or you're basically told to go cold turkey in South Africa?
That's a real concern because, as an example, where I am in Australia, alcohol bottle shops are actually designated an official. They were designated a service that couldn't close. So unlike in South Africa, they weren't banned. And that was because it was understood that people that drink daily, if they were to suddenly stop drinking, would be in much more problems in withdrawal than continuing to drink. So it is a real problem to just take away the supply. That's not actually going to solve the issue.
How do you prevent the risk of addiction in the first place then?
Well, that's a $1 million question there. I don't think anyone really has the answer to how to prevent addiction in the first place. But what's really important is to, I guess, the antidote to addiction is to connect, to be able to have solid connections with people, with our friends, with our partners. And of course, that's the issue with the COVID-19 lockdowns, is that for many of us, we haven't been able to connect with our friends. We haven't been able to feel that sense of belonging. And so that in itself can actually cause people to turn to drinking and to taking drugs more than they did before.
Well, I know it's all because of the outbreak, but it's governments that have disconnected us. How can governments reconnect us then?
Well, I think it's interesting that in some countries it's called physical distancing, not social distancing, because we have technologies that can help keep us connected. They don't necessarily, work as well as just a proper hug or a proper kiss. And I think, proper talking side by side, it's really hard to replace that sense of connectedness. So I guess what governments might want to do is to obviously help get us through this crisis as quickly as we can, so we can get to the other side of isolation and start to reconnect on a physical level. Now, hopefully there's a vaccine that would obviously help, but this is something that globally we're in for the long haul, and we have to try and get through and stay connected with each other in the meantime.
Hope a lot of people are listening and connecting with our talk today. Dr. Barrett, RMIT Australia, thank you very much. And now your chance to ask the questions. Here's our science correspondent, Derek Williams, with some of the issues you guys have been raising with us.
Can you tell us about the vaccine Russia claims it has produced?
Over 150 vaccine candidates are under development worldwide at the moment, and 4 of them are currently in what's called phase 3 testing. That's when a candidate has been proven safe, so it can be given to thousands of people in wide-scale trials to see how effective it is at preventing them from contracting COVID-19. Now, last week, the director of a Russian institute announced that after positive results from small-scale trials, it would also go into wide-scale testing with its candidate sometime in mid-August. That candidate is what's known as an adenoviral-based vaccine. Now, that's a platform that's been around for decades. The method works by modifying another virus called an adenovirus to deliver the genes that encode for proteins found in the spikes that dot the surface of SARS-CoV-2. That, it's hoped, will train the body to recognize and fight off the new coronavirus in the future without having to be infected with it in the first place.
What are the chances of recovery for a patient receiving blood plasma from someone who has already recovered?
Convalescent plasma is isolated from the blood of patients who have recovered from the disease, and it contains antibodies that help fight off a recurrence in that person. Now, this plasma has been used as a treatment for others who are still ill with more or less success in different diseases for around 100 years now. And for the last few months, it's also been used on an unprecedented scale as a stopgap measure to try to fight COVID-19. That's allowing larger scale studies, but the researchers trying to carry them out have hit a couple of big speed bumps. First, if someone is sick with COVID-19 and they're getting sicker, they don't want to end up in the control group in a randomized trial and be given a placebo, of course. They want the convalescent plasma. And second, it's very difficult to standardize results because convalescent plasma isn't a drug that's made in the factory at particular doses. It's made in someone's body. So no two doses of it will be the same. That's why, although a few smaller studies have claimed benefit and the treatment seems to be for the most part safe, the scientific jury is really still out on whether or how much it actually helps.